Lagevrio, Molnupiravir, is an oral antiviral medication authorized by the FDA under Emergency Use Authorization, EUA, in December 2021. It is designed to treat mild to moderate COVID-19 in adults who are at high risk of developing severe illness and cannot access other FDA-authorized treatments. How Lagevrio Molnupiravir works. Lagevrio, Molnupiravir, is a nucleoside analog that interferes with the virus's ability to replicate. By disrupting its copying mechanism, it helps reduce the viral load and limit the progression of infection. Correct dosage and timing. To use Lagevrio Molnupiravir correctly, follow this standard adult dosage: 800 mg for 200 mg capsules, orally every 12 hours for 5 days. Start treatment as soon as possible after a COVID-19 diagnosis and within 5 days of symptom onset. It is essential to complete the full 5-day course, even if you begin feeling better. The safety and effectiveness of using Lagevrio Molnupiravir beyond 5 days have not been established. If you become hospitalized after starting the medication, your provider may decide whether to continue the full course. Key administration guidelines. Take with or without food. Swallow capsules whole. Do not chew, crush, or open them. Do not skip doses or double up. If a dose is missed and it's been less than 10 hours, take it right away. Otherwise, skip it and continue with the next scheduled dose. Never take 2 doses at once. Important safety information. Lagevrio Molnupiravir is not FDA approved but is authorized for emergency use only. It should not be shared with others, even if they have similar symptoms. No dosage adjustment is needed for older adults. Birth control is strongly recommended. Women should use contraception during treatment and for 4 days after the last dose. Men should use contraception during treatment and for at least 3 months afterward due to possible sperm damage. Possible side effects. Common: diarrhea, nausea, dizziness. Rare but serious: allergic reactions, rash, itching, swelling, trouble breathing, vomiting. Seek medical help immediately if symptoms of COVID-19 worsen, such as trouble breathing, chest pain, confusion, or bluish skin, or if you experience a severe allergic reaction.